We welcome you back. With the return to sports after a widespread shutdown because of COVID, doctors say they're seeing lots of student athletes or even weekend warriors taking advantage of this weather, working out outdoors, coming up with foot and ankle injuries. We're not talking about just sprains either. Joining us this morning on the Health Watch is Dr. Megan Walters, a SLUCare orthopedic surgeon. Good morning to you.
Good morning to you as well.
Are you seeing a lot more foot and ankle injuries, and what are they?
I don't know that we're necessarily seeing more. I think we're seeing a little bit of a different pattern of injury than what we typically see. Sprains are the most common foot and ankle injury that we see across the board. We are seeing those a little bit more in an older age range at this time because people are being more active because of COVID and things like that.
Yeah, and as people get older, they're more vulnerable to injury, correct? I mean, they're not the high school athlete anymore.
Yes, our ability to just bounce back is a little bit slower as we age. And so we do notice that in patients that don't just gradually return to athletic activity or sport, that they can tend to have a little bit higher rate of sprains or soft tissue injuries and Achilles ruptures, specifically in the foot and ankle.
Yeah, Achilles ruptures, that sounds incredibly painful and terrible. I want to ask you first, I heard somewhere that sprains are sometimes worse than breaks. Is that true?
I don't know that I would necessarily phrase it like that, but sprains can definitely take just as long, if not longer, than breaks to get over. And bone is very unique in that it heals with bone. It doesn't heal with a scar, whereas skin, tendon, ligaments, they heal with scars. So the healing may not be as good with sprains as with fractures.
All right, so we got another stretch of really nice weather. A lot of folks going to want to go hiking, maybe outdoors, play some hoops or something like that. What are some of these tips you can give everybody that we can do to prepare to hopefully avoid these kinds of injuries?
Yeah, so I think the big thing is stretching before and after any time you're going to be physically active. Specific for the foot and ankle, you want to make sure you stretch your calf muscles out anytime you're going to go on a long hike or anything like that. It's also important in preparation for activities like that, that if you are doing any strengthening or conditioning, that you're working opposing muscle groups so you don't get stronger on one side than the other. So it's important to do that. And then good protective shoe wear. I know for basketball, a lot of times we're recommending high top shoes. Hiking, I think high top boots are nice just to protect that ankle a little better. But in general, good shoe wear, stretching, listening to your body are the important things.
Ah, there we go. Listening to your body. All right, doctor, thank you for joining us. We appreciate your time this morning. And for more information on prevention and care of foot and ankle injuries, you can go to slucare.edu/healthwatch.